Because there's no diagnostic test for resistance, Dr. Moorhead and I decided to try to write up an algorithm or flowchart to help practitioners make a determination when they have a case that comes in that is suspicious for resistance. This flowchart is based upon the concept of microfilariae being in the blood and being susceptible to the drugs that we use, the macrocyclic lactone drugs. And so Tim Geary, Dr. Tim Geary from McGill University, published a paper several years ago where he suggested that we could do a microfilarial suppression test and look at the reduction in microfilariae levels in the blood as a test to confirm or reject the presence of resistance. So we used that as the main point of our decision tree. And so the way the decision tree works is that when the dog comes in, the first thing you're going to do is determine if the dog is microfilariemic. To our knowledge, every single case of drug-resistant heartworm, the dogs have been microfilariemic. So if there's no microfilariae in the blood at the time of presentation, but there's not positive antigen test, it's highly unlikely from our experience that that's resistant. And there's actually no way to confirm or refute it. So basically, we would just recommend you just treat the case as a normal case of heartworms. There's no risk of transmission of resistant heartworms. In the rare possibility that that case was resistant, it can't be transmitted to another dog. So there's really no reason to manage it any differently from any other positive heartworm case. If the dog does have microfilariae in the blood, then that would be suspicious, because dogs that are on compliant prophylaxis with macrocyclic lactone drugs should not have microfilariae, or they should have very, very low levels. So if a dog presents with a history of compliance and a proper testing history, and it's microfilariemic, right from the start, that's going to be suspicious. And so what we recommend doing is then taking a blood sample, determining the number of microfilariae present per ml of blood using a NOTS test, and then treating the dog with a microfilaricidal dose of macrolactone. There's a number of choices of drug that can be used for that. And then come back a week later and take another blood sample and count the microfilariae again. We would expect to see greater than 75% reduction. In most studies that have been done previously, the reductions tend to be very rapid and profound, and 90% or much higher than 90% typically is seen in microfilarial reductions. So if you get less than 75% reduction on that test, that's going to be highly suspicious for resistance.